Hi everyone, Dr. Michael Miyazaki, and I'm really excited today to talk to you about endodontic irrigants that are activated. Activation of your endodontic irrigants is so important. So let me give you an example. If we do a root canal and you file and you file and you file and you file, you still can't get the entire canal system cleaned out. And if you then obturate it and close that up, the patient's going to call you up and say, "Hey doc, I've got a toothache. It still hurts. I thought you did a root canal, took all the nerve out." That's a terrible feeling, right? So let's figure out what we could do to minimize the chance that our patients are going to have any post-op discomfort. And today's topic, I think, is really critical to us having endodontic success. Because think about this. Have you ever watched a dog or have a pet or have watched somebody watch their pet? And you mix it up with your clothes, and some people I know, they get squeamish. I mean, I love my dog, but if when you have your dog's dirty towels and you mix it with your dirty towels, sometimes that makes us think, wow, am I getting everything as clean as it can be? So would you take those towels and just throw it into your washing machine and run it dry? No. What you would do is you would add water and soaps to emulsify all the soils that were in those towels. But would you stop there and just let it soak in still water? No. What you would do is you'd agitate it. You would mix all the water up so it gets in between all the fibers of those towels, and so that it emulsifies all the oils and gets all the dirt and everything else that might be in those towels and gets it into the water, because then you can rinse the water out, but now the towels will be clean. So this example, I mean, would you just let the money sit there in this water and assume that it's getting as clean as it could be? We have this very tortuous canal system. And as we get into the main canals with our files, because that's what we can see, that's what we can access from the coronal portion of our endodontic access, we have all those anastomoses. So what I need to do is I need to get my irrigants in there, and then I need to agitate it all up. I need to shake it all up and force all the irrigants that we've talked about in our last programs into all those lateral spaces. And then along the canal walls where the tubules are, I need to clean those areas out and get rid of the bacteria. So that's our subject for today. That the effectiveness of our irrigants depends on the streaming action and the chemical ability of our irrigants to dissolve tissue and disinfect the canals. So when we do it passively with our irrigation needles, it's been shown that our irrigants sometimes don't go very far beyond that needle tip. And if we just increase the volume of our irrigants, that doesn't do the work. What we have to do is we have to get the irrigants into the canals. Then we have to energize that liquid to move everything and to really dissolve the tissue. So there's been some other cordless activators, and this is a sonic activator. And what it's going to do is it will, again, mix everything up. So it's going to be like that agitator in our washing machine. It is going to provide energy, and the energy is going to create cavitation, and it's going to kind of blast out all the tubules so we get a cleaner canal. And so through fluid hydrodynamics, we get better debridement and disruption of the smear layer, the dental mud that lines our canals, and the biofilm, which is that bacteria. And in soda water, this is what that looks like. You can see the formation of the bubbles. The bubbles are formed because that little tip is wiggling at about 1500 to 6000 hertz, and it's providing the energy. So imagine if that's your irrigant and you've got, let's say, pulpal tissue, and that tip comes down there and starts shaking. Now it's going to basically force our irrigants into that tissue and dissolve it faster. It's going to, imagine a canal of dental mud attached to the inside because you've got the rough surface of the tubules, and now we're going to loosen up that dental mud with our irrigant. That's going to be a great service. And at least with the sonic activator, I was reading the research, and their claim is it dissolved the tissues 12 times faster when continuously agitated versus if you just irrigate with your needle and you don't agitate that liquid. Now, what I've been talking to all about is what we call the Endo Ultra. The Endo Ultra from Vista Apex provides ultrasonic activation. And so now we're up to 40,000 hertz. So it's 200 times stronger, And now watch what this does in that soda water. It's like the bubbles just explode. So that's cavitation. It's energy. It's going to force our irrigants to the side. It's going to loosen up the smear layer. And we're going to get extremely good cleansing of that canal. So compared to that sonic irrigation, you can see how much more energy there was. And it proved to be more powerful. And because of that, it was able to eliminate more debris. So if I can do just my needle irrigation, I can get the irrigant into the canal. If I can do sonic irrigation, I can provide a little bit of energy and some cavitation energy to help clean that canal and loosen things up. But with ultrasonic energy, you saw how much more powerful that energy was. And so we can clean the lateral canals out better. We can remove the smear layer better because that ultrasonic vibration generates that continuous movement of the irrigant. And so even in areas with a difficult anatomy of the canal system, we're able to get better cleanliness. So in this lit review, it said it can be concluded that it's most advisable to supplement the conventional syringe irrigation and in the initial phase of canal preparation with the final phase of intermittent passive ultrasonic irrigation after sufficiently preparing the root canal system. So I typically will start to use this once I have my canals filed out to at least a 25, because now I have room in the canal for the tip of my endo ultra to vibrate and create that kind of ultrasonic energy within the canal system. And that when we do that, it improves the elimination of bacteria and the smear layer throughout the canal system, which in turn, and this is the main point of why we're doing this, contributes to a higher success rate for our endodontic treatment. And that's why we're doing this. Because by doing conventional irrigation to get the irrigant into the canal, then using our ultrasonic energy to create the cavitation and to remove the smear layer and to disinfect that canal, we're going to have greater success. So what I'm going to show you is that this little tip is the equivalent of a 2002 activator tip, and where we're going to work it down this canal system with the die. Now, as I work it down the canal system, you'll see the tip kind of working its way down here. We have like a little vapor lock down there, and as the tip starts working its way down here, it never actually gets down here, but you'll see it breaks up the vapor lock. And so now this die will get all the way down to the working length. Then throughout this area, you see some lateral canal spaces, and some of the dye just passively is coming into these lateral spaces. But with our ultrasonic energy, you're going to see it begin to tie these two main canals together. And that's the impressive part. So as I run this video, we're going to start to see the tip. You can see it's working its way down. And now because the tip is coming down here, we're getting the dye down to the apical end of the root, whereas before we had a vapor lock in there. So now imagine this is our irrigant getting down there. Now in this middle area, look at how that's working. We're getting into all these lateral canals, the anastomoses of the lateral spaces that we would not be able to clean even if we got our files in there and went to an 80. We could not clean that area out. And all that file would do is weaken the root structure. So look at how just running the endo ultra through the top canal, how we're joining the two canals together with the dye. We're getting all that energy in, and so our irrigants are getting into those lateral spaces. Now this is another diagram kind of showing the same thing. So the red is showing areas where the tissue's been dissolved. The green is showing where there's a remaining pulp tissue. So here where they did passive irrigation, there's a main canal here, a main canal here. Now in this main canal, they cleaned out 95% of the bacteria, here 70, left 30% behind. But in the isthmus between these main canals, only 27% of the tissue was removed, and that left more than 73% still there. And if this can leak into the apical region or the sides of the tooth, the tooth root, we're going to have issues. Whereas down on the bottom where we use ultrasonic energy, here you can see this canal is cleaned out 100%, and the isthmus almost 100%. So that's why I find that when I place my irrigants in my canals systems today, I can't just leave it without doing some kind of ultrasonic irrigation. I get in there and for a minute, I'm just pumping that irrigant into those canals, into those lateral spaces, letting the ultrasonic energy do its work. I feel like it does such a better job of cleaning out those canal systems than when I just did it passively, that it's hard to understand why I didn't do ultrasonic activation all this time. So the Endo Ultra is providing that energy. And when you look at all the literature that supports it, there's a low risk of apical extrusion of our irrigating solutions, because I know that's something that a lot of clinicians I speak to, they're concerned about, that they want to make sure that they don't have their solutions go out beyond their working length. The combination of conventional irrigation with the ultrasonic irrigation facilitates the procedure, improves the elimination of bacteria and the smooth layer, leading to a higher success rate, which is important. The use of the ultrasonics during irrigation statistically in a significant way takes the bacteria down much better than instrumentation alone, and that 1 minute use of ultrasonics after instrumentation with your files resulted in significantly more tissue dissolution, yielding cleaner canals and isthmuses, as we saw in those diagrams or the illustrations I showed you before. So here's another example just showing that sonic activation, which you see in the left-hand circle, leaves a lot of the canals uncleaned and only cleans out about 6%. Whereas the ultrasonic activation cleaned out 89% of the canals and left much less of the unclean canals. So on the bottom down here I'm just showing how that ultrasonic energy looks. I've got the cloudy solution. It's got a lot of dental mud in there. But when I apply that ultrasonic energy, you can see how that liquid is then energized and how that's going to remove the smear layer. And you just have to get in there and clean it out very well. So the Endo Ultra is coreless. It helps promote penetration of the irrigants into the dental tubules and those canal complexities. It disrupts the biofilm, because this isn't just bacteria that lines the walls, but it's biofilm, so it's organized colonies of bacteria. It removes the vapor lock at the apical area, and we saw that with the blue dye. Greatly reduces the bacteria levels and improves the root sealing, because when you remove that smear layer, your bioceramic sealers can then adhere better to the canal walls. And it's easily incorporated into your existing endo irrigation protocol. You use the same irrigants, it's now you activate it. So it doesn't take much time. And with the file systems being as fast as they are, you've got some time to really get in there with the ultrasonic energy and clean those canals out. So it's 200 times more powerful than the sonic competitors, and it's cordless. So it is a great piece of instrumentation to have. So going back to what we've talked about during the last presentations where I've talked about endodontics, sodium hypochlorite, make sure you use a pharmaceutical grade sodium hypochlorite, not Clorox that you dilute, because you don't really know what the concentration is. Use EDTA to remove the smear layer. Now we don't want it, once you remove the smear layer, I recommend you use sodium hypochlorite once again, because when you open up those tubules, you want the sodium hypochlorite to get back in there, disinfect those areas, and kill any bacteria or dissolve any tissue that may be left behind. But now be careful, don't mix your sodium hypochlorite with your chlorhexidine, or you get the precipitate, which you don't want to happen, because that discolors the tooth and could be carcinogenic. So we have the enhanced solution protocols where you just use Chlorextra. Now Chlorextra is your 6% sodium hypochlorite, but with the surface modifiers, so it works faster. And then instead of using EDTA and chlorhexidine, you use Smear Off, which is a 2-in-1 solution. It will, in addition, remove the smear layer and disinfect, because it's got the effects of chlorhexidine. But if by chance you mix the Chlorextra, which is sodium hypochlorite, with the Smear Off, you will not get that precipitate. So instead of having to have 3 bottles with the conventional protocol, now you only have 2. Instead of having to worry about mixing sodium hypochlorite with chlorhexidine, now you can have the benefits of both and not have to worry about creating that kind of precipitation, the fallout, the discoloration, and all the ill effects that could have. And as you're using each of these, I like to use Endo Ultra. So when I'm using my sodium hypochlorite, I like it to get in there and dissolve all that pulpal tissue. When I move in my EDTA, I'm trying to remove the smear layer. So I need to activate that energy to really scrub those walls and get all that mud loosened up so I can flush it out. And then if I'm using chlorhexidine, hey, at the very end, I want to kind of get that into all the nooks and crannies. And so I use the Endo Ultra one more time. So it's not hard to do. It's going to make your root canals be more successful. With the conventional protocol, you can have 3 products, having to remember to rinse between the sodium hypochlorite and the chlorhexidine. With the enhanced protocol, you only have 2 bottles and you don't have to worry about creating that precipitate. So again, I like the more advanced protocol. It's faster, it's safer, and it's even more effective. So a lot of times when I'm doing my root canals, I get in there, I do my access, I get my 10 file just to find those canals, and I use my Endo Explorer. I'll use a gel lubricant, maybe something like the RC Prep or the equivalent, to lubricate my files as I start to get down into the canal. I'm using a rotary file system now where I use an opener. We're not trying to get down very deep, but we're just trying to open up the orifice to make the rest of our root canal much easier. I use a 10 file just to guarantee that I have patency as I am working in these canals. A gel lubricant, because I know I'm using an apex locator. And the gel lubricants a lot of times are an EDTA type of gel. So unlike sodium hypochlorite, they will typically help my apex locator work even better. Then I have a glide path drill that's a little bit narrower. It's a 15.03, and I use that to get down on my working length. And now I'm using my apex locator on my handpiece. So I'm again using a gel lubricant. Now I'm not using a lot of Endo Ultra yet because there's not enough room in the canal system. If I put the Endo Ultra in there, it's just going to wedge the little tip, even though it's a 2002, and it's not going to let it move much. So I'm not going to use it yet. Then I use a shaper file. I'm at an 18.045, so it's still fairly narrow taper, and I get that in there. But now as I'm shaping, I start to use my irrigation. So I'm using my sodium hypochlorite, or I could start using my smear off. I could even start using my EDTA. But now the canals being prepped, so it's getting a little bit bigger. When I get to my finishing file, which is my last rotary file, it's at a 3004. So now at a 30, I can put my Endo Ultra in there and I can really activate it better than I could before when the canal was much smaller, like a 15 or an 18. So now I am finishing everything up. I make sure I get a lot of irrigant down there. I make sure I get a lot of activation going using my sodium hypochlorite and my smear off with the advanced protocol, and then my 10 file just to make sure that everything is patent, that I'm not impacting dental mud down into the apex of my root canal system. So this is where I start to really use it Endo Ultra because we have room within the canal to really activate that solution. Once I get everything cleaned up, I've got my irrigants done, I've got my Endo Ultra done, so I've been activating it. Now I rinse the canal out, I dry out the excess moisture, and using a single master gutta percha with my bioceramic sealer, I actually then obturate that canal. Now, some of you don't do a lot of root canals, and to have all this solutions and needles and everything like that is kind of cumbersome. And Vista Apex has what's called the Canal Clean Kit. And this Canal Clean Kit, we've got Chlorextra, we've got Smear Off, we've got these evacuation needles. And the nice thing about it is it comes in this vacuum lock pouch, and it is very cost effective if you don't do a lot of root canals. But when you do your root canals, you want to make sure that you have very fresh solutions. So we've got the Chlorextra, the Smear Off, we've got irrigation tips, and a micro aspirator with the tip, all in this little like vacuum seal little package. So keep those refrigerated, and when you find yourself needing to do a root canal, just pull that out, open it up, and you've got all the greatest irrigants. Now, one of the things that we're really excited about is Vista Apex is going to be launching the indicator. And the indicator is a way for us to check to see what the bacteria levels are within the canal system. How does it work? Is that the cells have ADP, our energy source, and other biomarkers. And so what you do is as you finish up your root canal, you withdraw some of the fluid within the canal system and you test it with the indicator to see if you've got the bacterial levels down to an acceptable level. So I'm really excited about this. It's going to be launching in April, and it's the first time that we can actually, in a very usable way, test that we've got the canals cleaned out. And with the protocols that we talked about, we should have really, really clean canals. And I want to point out some just other adjunctive tools. We have the Lastivac, which is just a flexible tip that you can put into the canal. So if you don't want to use a lot of paper points, just put this little tip down there and suck out all the moisture. We have the HVE adapters. We've got precision irrigators, because I know some of you use microscopes, and so you don't have water going everywhere. You can use a precision irrigator. And then we have these blue flow tips that are ideal for irrigation, aeration, and even your impression materials. And so these are all available from Vista Apex if you need to get some of these adjuncts. So in summary, and we've covered this over many different programs, is that today we're not just trying to mechanically clean out the canals, but we're trying to chemomechanically clean the canals. Irrigation is a very important part, because we cannot clean the entire canal system with our files. We need to have the irrigants to get into little nooks and crannies. If we're going to use these irrigants, let's use the advanced irrigants that have the surface modifiers, so they work faster and more effectively than our more traditional irrigants. But if we're going to use a traditional irrigant like sodium hypochlorite, make sure it is a pharmacy grade sodium hypochlorite, not Clorox bleach that you get off your store shelf. The ultrasonic activation is really beneficial, because that's a way to agitate the fluid, to get cavitation, to dissolve tissue faster, to clean out those little lateral spaces. And we saw that with the blue or the purple dye of our energy forcing the irrigants in between the main canals. And then now we have some adjuncts. We have the different tips, and we have the endocator, which is a post cleaning testing that we can do to make sure we have the bacteria down to sufficiently low levels. So, and everything that I've talked about over the past few programs, I hope you understand that endodontic irrigation is simpler today than it ever has been. It can lessen the amount of inventory you have from just the number of irrigants and the number of tips that you need. But even though we've simplified things, we are not sacrificing quality. That if we follow these protocols, we're going to be much more effective, and we're going to be more effective. And because of that, we're going to be faster. And then we're also going to be safer with these irrigants, because many of these irrigants are less cytotoxic, like the sodium hypochlorite versus Chlor Extra. Chlor Extra is less cytotoxic. And so why don't we choose to use solutions that are simpler, more effective, and safer? I don't know. There's really no reason not to. So I hope I've kind of convinced you. We are a community of like-minded clinicians trying to do the best for our patients. And if you like this information, hit the like button. If you want to subscribe so you don't miss any more of this information, hit subscribe. And I look forward to seeing you during the next program. Thank you very much.